Good afternoon, ladies and gentlemen. Thank you for inviting me to your excellent knee meeting. Unfortunately, I'm not there in person, but I'm happy to present my talk in this digital way. We'll talk a bit on SPI, a solution to increase and standardize quality of care in the OR. Why is standardization important? So I want to show you a bit on the background of our hospital, why we started with that project. We're a purely orthopedic hospital, high volume. You see the numbers there. This is done by 4 senior surgeons, but we're also a teaching hospital with 11 residents. So the problem at that time was the limited OR capacity, so that we were able only to perform 3 to 4 primary knees or hips in a day. And the goal was to do at least 5 a day, because that is economically efficient, but also from the medical standpoint advantageous. So the objectives of the project were first to reduce the surgical time, but simultaneously it was very important for us to reduce the complication rate, improving the teaching concept and showing a transparency of the OR result. Main challenge in that project is to agree on one standard, but that is important to speed up things, and this standard includes the instruments and all the other parts. So you can get from the company side those toolboxes with the workflows, but as I said, I think it is very important to make it your workflow, and that makes it also a lot more efficient. This is how it looks like. You see the big Excel sheet, left side the different surgical steps. In the middle, your surgeon's note. This is then later transferred to your OR report. And on the right side, the instruments, so that the scrub nurse can see what is needed for the next step. Foot pedal. So it's a foot pedal guided process. You go to the next step with your left pedal, and the right pedal is for the exceptions. And the exceptions that can happen if the anatomy is maybe not the standard, or you have to do a specific procedure or a specific step, then all these exceptions are documented and the OR report transferred. You can also add some videos or pictures in your OR report. So additionally, you get the teaching videos for your scrub nurses and also for the young assistants, so that they can learn step by step your standard workflow in the OR. What about the results? Does it really work? So you have the option of these tool insights. There all the procedures are stored, and then you can get a monthly or 3-monthly result. So here you see, after we have introduced the SPI in our OR, that the mean surgical time was reduced by around 20%, and that occurred very early on, but we speeded up things also continuously. Even if you see, if you look here, after 3 years, we are still getting a bit faster. So it's an ongoing process, and we also try to improve our workflow continuously. That's another option you have. You can analyze the different surgeons you have. So especially maybe for the younger ones, it is very nice to see where is the problem, and then you as the senior surgeon can help him at that specific step, so you don't have to be there during the entire surgery. This is a very nice tool. So the times for sitting in a specific room and dictate your OR report, those times are over. On the right side you see the standardized OR report, but you are able to include all the exceptions, all the videos and pictures, as I said. So that's, I think, a very nice digital way that also saves you a lot of time. So to summarize, standardization and digitization using SPI technology in total knee and hip is leading to shorter process time, around this 10 to 20%. That gives us one extra surgery per day. And with what is very important, simultaneously reduce the stress levels for the nurses and doctors. You can also use it for complex revisions. That helps you to reduce the learning curve there. And again, of course, you speed up the surgical time and an improved interaction within the team. Very important, I think, for this quality process, the medical leaders must guide the process, otherwise it will fail. Thank you for your attention and enjoy the rest of the meeting. All the best. Bye-bye.